Hi friends, I am Dr. Toishi Sharma, Interventional Cardiologist, and today we will talk about the immediate steps you must take after a heart attack. So friends, if you or anyone you know is having a heart attack, then it is of utmost importance, number one, to seek medical attention as soon as possible because time is muscle. What that means is with every passing minute, you are at a risk of losing the heart muscle forever. So the sooner you get to the hospital and the sooner you can be started on medications, then there is a higher chance of saving the heart muscle. We have seen many cases where patients present to the hospital within an hour or so and they undergo coronary angiography and a stent placement and they have 0% long-term damage to their heart muscle. Their heart muscle can completely recover from the heart attack. So, if you or anyone you know is having chest pressure, chest pain, along with lightheadedness, sweating, or feeling like an elephant is sitting on your chest, do not waste time and call for emergency medical services 911 as soon as possible. Number two, when you are in the hospital, make sure to follow all the guidelines given to you by your caring team. The procedures that are recommended, like the catheterization procedure or the medications like blood thinners like aspirin, Brilinta, or heparin, these are crucial in reestablishing the flow to your heart, and therefore adhering with these recommendations can be vital to your heart as well. Sometimes the length of stay can be long and patients can get impatient. However, please understand that the protocols are very closely monitored and every intervention is very important to reestablish flow to your heart and also save as much of your muscle as possible. So do not even think of leaving the hospital against medical advice or leaving the hospital sooner than your care team feels you should go. Number three, after you are discharged from the hospital, make sure that you are compliant with all your medications. Especially if you have had a stent placed, then it is even more important that you take your medications because if you stop your medications, then the stent will clot itself and you can actually have an even bigger heart attack than what you initially had. So please understand that putting a stent does not mean that we have resolved the issue. I tell my patients that putting a stent is just like putting a band-aid on a wound, meaning we took care of the acute problem, but actually the whole pathogenesis of coronary artery disease, the whole process why you developed blockages in the first place, that process is still ongoing. Unless we stop it with medications like statin medication that will decrease the cholesterol and inflammation, like aspirin and Plavix that will thin your blood, prevent it from clotting again. If you do not take these medications, then you are putting yourself at even higher risk of a recurrent heart attack. Number four, cardiac rehabilitation. After a heart attack, it is very important to go to cardiac rehabilitation program, which is a supervised exercise program where you will be monitored as you start your exercise again. Your heart rate, your blood pressure, your telemetry will be monitored so that you can safely resume your daily activities and hopefully even get to a place where you are more active than where you were before your heart attack. In addition to this, in cardiac rehabilitation, we have services like smoking cessation, dietary advice, and meditation and yoga as well in many centers. These are shown to be very helpful in not just recovery, but also for improving the long-term outcomes for cardiovascular patients. Moving on. After a heart attack, you should be very careful about the warning signs of a heart attack. If someone has had a heart attack, they are obviously at a higher risk of having a heart attack compared to someone who has never had a heart attack because your body has already shown that there is a disease process ongoing. So you should be careful for warning signs like recurrent chest pressure, chest pain, sweating, nausea, dizziness, and closely monitor your symptoms and present to your doctor or your ED physician if these tend to recur. Lastly, my friends, you should commit to a much healthier lifestyle. If you have been smoking, this is a big warning sign that you should absolutely stop smoking. If you are overweight, then you should get on a diet plan, an exercise plan. If you have been sedentary, this is a warning sign, then you should start exercise. Try to aim for at least 150 minutes of exercise on a regular basis per week. And additionally, if you have been eating any fried foods or red meat, then it is time to get rid of them. So friends, I hope this video was helpful. If you've had a heart attack or any of your relatives or friends have had a heart attack, please share this video for them, and I will see you in the next video. Thank you.